Om Shri Sai Ram. My pranams to Bhagavan Sri Satya Sai Baba. Our monthly health webinar tonight is on painful shoulder and will be presented by Dr. Arul Srinivasan and Brother Kaviarasu Mahalingam. Dr. Arul Srinivasan works as a consultant rheumatologist at the Mid and South Essex NHS Foundation Trust. She has several research publications in the field of medicine and is the author of a chapter on chronic back pain in the textbook of Management of Spinal Disorders. She has given several talks on various musculoskeletal conditions at regional and international level. Dr. Srinivasan has served on many medical camps with Dr. Upadhyay and the team, and each one has been a blissful Sai experience. She is currently Region 3 President. Having been in the Sai fold since 1968, Dr. Srinivasan prays to Swami to use her as his divine instrument to serve the needy in any capacity. Kavi Mahalingam. Brother Kavi Mahalingam is an advancing physiotherapy practitioner with 16 years of experience in musculoskeletal, neurological and cardiorespiratory conditions with a special area of interest in neck, shoulder, back and knee conditions. He completed his bachelor degree from the Tamil Nadu Dr. NGR Medical University and MSc Advanced Physiotherapy Practice from Coventry University and has worked in India and Malaysia. Currently, Brother Kavi works as a community senior physiotherapist within East Suffolk and Northeast Essex NHS Foundation Trust. He has conducted knowledge transfer programs for the children and adults regarding posture and its importance. He has also developed prototype traction device in treating early osteoarthritis and presented at Falling Walls Research Competition, Germany. Being an advanced evidence-based practitioner, he publishes articles and is also involved in research activities. Brother Kavi was a Bolavika student, and since 2008, he has been actively involved in medical camps, blood donation camps, and community cleaning services in Malaysia. He has conducted yoga classes for children at Sai Center at Kota Baru, Malaysia, and believes in Swami's message of love all, serve all. Om Sai Ram.
My humble pranams at the lotus feet of our beloved Bhagavan. Sai Ram, brothers and sisters. I'm just going to talk on shoulder pain and touch on the causes, symptoms, and briefly discuss the treatment options. Shoulder pain is not as uncommon as we think. At any given time, 16% to 26% of the population will be suffering with shoulder pain. Shoulder injuries are also very common. 8 to 13% of all sports injuries will involve the shoulder. People present with different symptoms when they have shoulder pain. So, taking a very clear history and examining thoroughly are very important to clinch the diagnosis early and to start treatment. The structure of the shoulder joint is made of bones, which is bony skeleton, muscles, ligaments, tendons. The tendons are the tapering ends of the muscles which are attached to the bones. Bursae, which are fluid-filled sacs, which act like shock absorbers, and there is one major bursa within the shoulder joint. And again, we should remember the nerve supply to the shoulder and the blood supply to the shoulder, because all these, if they are faulty, can give shoulder pain. The main shoulder joint is made of 4 smaller joints, which are all interlocked to make the total shoulder joint. The first and major joint is the glenohumeral joint, where the arm joins the shoulder. Acromioclavicular joint, which is the top joint where the collarbone joins the shoulder. Sternoclavicular joint, where the chest bone joins the collarbone and then in turn the shoulder. Scapulothoracic joint, which is the shoulder blade joining the shoulder. The stability of the shoulder when the shoulder is not moving is maintained by glenoid labrum, which is the lining of the shoulder, and the shoulder capsule, which covers the shoulder totally and protects it. During movements, the shoulder stability is maintained by the tendons. There are two groups of tendons. First is the rotator cuff tendons and then the biceps tendons. The rotator cuff is made of 4 muscles and tendons. It holds the shoulder blade to the long bone of the arm. And most of the shoulder pain that we see in a day-to-day situation is due to rotator cuff dysfunction. Rotator cuff is made of supraspinatus muscle, which is the first muscle and the most important. It helps to lift the arm and also protects the shoulder from the front. Subscapularis muscle, which helps with inward rotation of the shoulder, and the other two muscles, infraspinatus and teres minor, help with outward rotation of the shoulder. Apart from taking a very clear history, just looking at the shoulder might give information. There may be swelling, there may be deformities, or there may be scarring. Feeling the shoulder for any testing for fluid within the shoulder, and also inflamed shoulder will be very warm. Testing the movements of the shoulder also is very important to get to the diagnosis. Rotator cuff tendon dysfunction is the most commonly seen, causing shoulder pain. The tendon could get inflamed, and this happens particularly when the tendon is twisted and stretched. For example, when you are trying to open the car back door while you're sitting in the front, that sort of stretch can result in inflammation. The tendon can tear either partially or completely after a fall, or in older age due to thinning and wear and tear, it can tear without the fall. Impingement or pinch tendons can happen when the tendons become thinner or partially torn. They can get caught between two bones. And occasionally, calcium can deposit on the tendon and cause acute inflammation or long-term pain. Of course, like any other organ in the body, wear and tear of the tendons are also important cause of pain. This is acute calcific tendinitis, which I mentioned. The calcium is deposited over the tendon here, and some patients have no symptoms at all because of this. Some develop very severe and sudden onset pain in the shoulder. Some have a chronic niggly pain due to this. This is impingement syndrome or pinched tendon. The green bit is the tendon and the blue is the bursa. They both can get pinched by the bones. When the tendon has inflammation, it gets thinned out, and also if it's partially torn, it can get pinched between the two bones. And the bursa is very similar. When it gets inflamed or it gets scarred and thinned out, in the long term, that can also get pinched. As we get older, when the shoulder joint wears out, bony spurs come out of the ends of the bone, and this can also put pressure on the tendons and cause pinching. With rotator cuff tendinitis, people are not able to lift their arm sideways on their own, but with the help of the other arm, they may be able to lift it with less pain. The movements are restricted, sideways movements, and also due to pain, they're not able to lift fully. With resistance, the pain is more severe in the shoulder or in the arm. Internal rotation, external rotation, that is inward movement and outward movement of the shoulder, both are restricted and painful. And again, with resistance, it can become more painful. Tears are not that common, but you can see it in older people. Usually, the sudden tear is due to injury, and in patients who have had chronic inflammation or elderly, due to wear and tear arthritis, which is osteoarthritis, the tendon gets thinner and thinner and then tears. The tears could be partial or it could be full thickness, complete tear. Biceps tendons is the other group of tendon that I mentioned. Biceps is the muscle, which is the arm muscle, which everyone tries to strengthen and make it bulkier these days by going to the gym. And this can happen in the younger individuals due to unstable shoulder. As you may have heard of people, younger individuals moving the shoulder in and out of the socket, and this is usually due to hypermobility or tendon laxity. They are able to do it. With this, the biceps tendon gets inflamed and injured. But in older individuals, usually it is secondary to the rotator cuff tendinitis. When you have biceps tendon, you're very sore when the pressure is put on front of the shoulder, and also when you try to bend at the elbow and bring your arm inwards, it can become slightly painful, and especially if resistance is put when you're doing these movements, then the pain is more severe in the front of the shoulder. Subacromial bursitis, which is the bursa, which is within the shoulder, can get acutely inflamed, usually due to trauma, or it can get inflamed due to the tendon that has been inflamed already. And you can see the bursa fills up with fluid like a tennis ball, as you can see in this picture. In chronic cases, the bursa gets thinner, scarred, and becomes fibrotic, which is a scarred, thin bursa, which can get caught between the bones, causing impingement. Adhesive capsulitis, which is what everybody knows as frozen shoulder. This is the capsule or the covering of the shoulder joint which gets inflamed here. It becomes thick and stiff. It gives constant and severe pain in the shoulder, and all the movements are restricted and painful, both active movements and passive movements. It could come on without any cause, or it could be secondary to various causes. I've listed some of them here, like an injury, stroke, heart attack, tendon inflammation, surgery, even vaccination, including COVID vaccination, or any other inflammatory conditions like rheumatoid arthritis, polymyalgia rheumatica. All these conditions can result in frozen shoulder. We shouldn't forget the general joint disease, shoulder joint disease, like osteoarthritis, which is wear and tear of the joint, rheumatoid arthritis, blood negative, seronegative we call it, inflammatory arthritis, conditions like gout or pseudogout, where there is calcium crystals, and infection, that is septic arthritis, infection within the shoulder joint. Acromioclavicular syndrome, I want to mention that because some people might comment that they only have pain on top of the shoulder. This is where the clavicle or the collarbone joins the shoulder. This can be acutely painful due to injury or infection. Or if the collarbone is broken, again, this can become suddenly painful. In the long term, it's due to wear and tear of this joint. And there is another condition called osteolysis of the clavicle, that is melting of the collarbone at the end. This happens with enthusiastic weightlifters, and when they do several number of push-ups. And this is because of putting constant strain and pressure on the end of the collarbone that it starts to melt. The only way to heal this is by resting and not doing these repetitive strain movements for at least some months. When you get this acromioclavicular pain on top, you're not able to push your arm backwards with the straightened elbow or lift it up with straightened elbow without producing pain on top of the shoulder. Usually the tests and investigations are not required in most cases. Some patients, of course, with rheumatoid or other inflammatory conditions, we do need to have blood tests. Otherwise, X-rays, ultrasound scan, MRI scan are done in some patients, and these are helpful to find out if there are tears or if there is impingement or pinched tendon. Testing the fluid, if there is a swelling of and fluid within the shoulder, testing it for infection and for gout or other crystals are also very helpful. Coming to treatment, usually it's conservative. Symptoms may get relieved on their own in due course in few months with painkillers and anti-inflammatory medication and gentle exercises. Physiotherapy is important for strengthening and mobilizing the shoulder, especially if it is frozen shoulder. Medical intervention is needed for some patients. Particularly steroid injections give short-term or even permanent relief if it's tendon inflammation, particularly if it's due to calcium deposition or due to injury or wear and tear of the tendon. When the joints are worn out, it can give some relief if the injection is given into the joints. Surgery again is needed in some cases. When there is pinched tendon, this needs to be released. This can be done by pinhole or as open surgery. When the rotator cuff tendon is torn completely, it needs repair to join both ends together and also to stabilize the shoulder. When there is only a partial tear, there is a likely chance that it can heal on its own. When the bursa is very inflamed and thin and scarred and it gets caught between the bones causing pinching or impingement, then this could be removed surgically. If the acromioclavicular joint is disrupted because of injury, especially a broken collarbone, this will need to be pinned and fixed. If a person has a chronic and persistent shoulder pain and is not a candidate for surgery, then a nerve block called the suprascapular nerve block can relieve the pain long term. Shoulder replacement surgery is also required in some patients, which can relieve the pain, especially if the joint is very worn, but it doesn't increase the joint movements from what it was prior to surgery. This is a very important slide. There are other causes that can cause shoulder pain, but this problem doesn't arise directly from the shoulder. Mainly, you can get referred pain into the shoulder from the neck. If you have arthritis of the neck bones, like the spinal bones, you can get pain in the shoulder. If there are trapped nerves in the neck, again you can get referred pain in the shoulder. Lower lung or abdominal problem if there are any lower lung or abdominal problems, you can still get shoulder pain, because the diaphragm, which is a thin membrane that is separating the chest from the abdomen or the tummy, is supplied by the same nerve that goes through the shoulder as well. So you can get a referred pain into the shoulder. There is a nerve bundle that arises from the neck from several levels, and it goes through the shoulder to supply the shoulder as well. And this bundle can get damaged, and it's called brachial neuritis. Sometimes tumors in the upper part of the lungs can also give referred pain into the shoulder. I just want to mention this because there are some differences between a pain that comes from a tendon inflammation or frozen shoulder and the pain that is due to nerve involvement, like trapped nerves or pinched nerves, will give slightly different symptoms. Apart from giving you pain, it can cause pins and needles in the arms and hands. It can cause muscle weakness or even muscle wasting, as you can see in the photograph. And when the nerve bundle, which I mentioned, gets damaged, you can have protruding shoulder blade, especially when you push on the wall. You can see one side of the shoulder blade will be lifted up, and that is due to weakness of the muscles. These are all signs and symptoms of nerve being affected and causing pain in the shoulder. There are some very important points to remember. Shoulder pain is very common. Pain may not always be in the shoulder, but mostly in the upper arm or around the shoulder blade. Movements may be restricted due to pain, stiffness, or weakness. Shoulder pain can improve on its own, but given time, 6 to 12 months, with rest, painkillers, and exercises. Exercises and strengthening are very important to help healing and prevent recurrence. There's one important point I want to mention here is once the tendon has been inflamed, it becomes thinner and thinner within days. So this needs to be strengthened back to its original size. Otherwise, you can get a recurrence. X-rays like blood test X-rays, ultrasound, MRI scans may be required in some people, but usually most cases these are not necessary. Again, steroid injections can give short-term or long-term relief, and surgery may be required in some cases to relieve pain. Brother Kavi now will be speaking on exercises and physiotherapy, which is the more important part of this session. Thank you for listening, Saira.
Sairam, brothers and sisters. A warm good evening to everyone. I hope you're all enjoying the presentation so far, and I hope to keep you in the same state. Well, 40 years ago, Sri Satya Sai Baba told the following words. The current belief is that medicine is to be valued for its use during illness. But this point of view has to change. Medicine is used to see that one does not fall ill, just as the purpose of truth is to so live that one is not subjected to birth again. Yes, I believe people started, changing their mindset. Exercise. Exercise is the main medicine that helps preventing the illness. Myself, Kaviarasu Mahalingam, in short Kavi. I am a senior physiotherapist based at Aldeburgh Community Hospital. I'm living in Ipswich, and I hope a detailed introduction has been given about me, but I don't want to repeat that information. Let's carry on with our topic. I know roughly we have 20 minutes to cover the things, but still, it's a good idea to recap about the shoulder joint, the shoulder disorders, and the role of a physiotherapist in the pain management and the exercises. The shoulder disorders can be broadly classified into three things. One is pain, stiffness, and instability. Pain is an unpleasant sensation for everyone. So the source of pain could be muscles, tendons, or ligaments, bones, or it could be an articular surface. Um, so muscles, the function is to move the extremities or move the joints, and ligament is responsible for holding it together, kind of stability. And bone is a structure that takes up the load of our body. And the articular surface is nothing but the surface of the joint structures. So usually the surface of the joint structure is covered by the cartilage. So if particularly in the long bones, we call it as a hyaline cartilage, which is present at the end of the bone. So if you look into any arthritic conditions, so the cartilage, if it is getting damaged, so it won't send any signals, surprisingly, because there is no blood supply or nerve supply to a cartilage. But the if there is any muscle damage or tendon rupture or ligament problem or bone problem, then obviously that would able to send the signal to the brain to stimulate the pain sensation. But cartilage, until it's completely getting damaged, we won't get any symptoms at all. That's the surprising thing. And that is the reason that we will be coming to know that our joints are worn off completely when we are starting to get the pain. A mild pain would be starting, but by the time the total cartilage is getting damaged, which is really ridiculous. The stiffness in the shoulder could reduce the range of motion, the range of available motion. For example, in the shoulder, we have about 180 degrees of movement. So we usually call the movements as flexion, extension, abduction, adduction, and the rotation movements. So if there is any stiffness in the joint, that will affect the range of motion. So the range of motion is really very important for our the muscles to play in its full capacity. The next thing is about the shoulder instability. So um, the ligament plays the major role in stabilizing our shoulder joint by holding the two bony ends close together. If there is any problem in the ligaments, obviously it will uh, affect its stability and leads to the shoulder dislocation. Well, the common disorders of the shoulders could be from the rotator cuff, which is the muscle bunch in the joint, and the glenohumeral joint itself, which is the ball and socket joint, and the acromioclavicular joint, the connection between the center bone of our body and the collarbone, and the collarbone itself, and the problem could be from the neck as well. Well, what do a physio do on your shoulders? Well, it's interesting. The physios do functional evaluation. So they will be looking into the shoulder joint to find out whether your muscles are weak, whether the pain is arising from the muscles or ligaments or the joints or from the bone. And they will be looking into the functional mobility, the range of motion. Usually a shoulder joint will move about 180 degrees. So they will be looking into the joint whether the shoulder range has reduced, and if the range is reduced, they'll be finding out whether the muscle is the problem, whether there is any weakness that is causing the lack of range of motion, or if there is any stiffness in your joint. So whether there is any adhesion in the capsule, or if there is any contractures. And they will look for stability. So whether the bone, the joints are aligned properly or not. So they'll be looking into all these things, and then they will be trying to addressing the problem that they have identified. If it is a muscle weakness, obviously we need to strengthen the muscle. Always a muscular imbalance could be of muscle weakness and tightness. So we would be addressing the tightness first, and then we will strengthen the weak muscles. And if there is any contracture, something like in a frozen shoulder. So in a frozen shoulder, mainly moving sidewards and rotating backwards. This movement will be limited. So we will be focusing on increasing the range of motion, particularly moving away from the body and rotating out. So we have to passively mobilize it, because whatever you try, you can't achieve the range of motion if there is any stiffness or contractures. So we need to passively stretch the muscles, and we need to mobilize the joint to make it free to move. Fine. And if there is any instability, it could be due to any ligament injuries, then we can't actually strengthen the ligaments, but we can strengthen the muscles which are surrounding the joint to stabilize the joint perfectly. I hope everybody would be having this doubt. If there is a pain in the shoulder, whether not only in shoulder, any joints, whether to use a hot water bottle or a cold pack. So if you ask me if there is any inflammation, any minor, tendon ruptures, or any swelling or repetitive stress injuries, obviously I would advise you to apply the cold pack. So the cold pack would help reducing the local inflammation, and it actually numbs the nerve and helps reducing your pain. Hot water bottle, when should you use that? If there is any stiffness, so I would recommend you to use like spasm or stiffness. You can use the hot water bottle, and that immediately dilates the blood vessels, and you will get more blood to that tissue, and it makes the tissue supple, and it helps reducing the stiffness. But in cold, it always starts with contraction and kind of constriction and relaxation of blood vessels that helps pumping them pain producing chemicals, and washes out um, the swelling, and helps treating the pain. Cold pack, usually it's advisable to apply for about 10 to 15 minutes, 2 times a day, or multiple times is also okay. You can do that for about 5 to 7 days. So if you go to a physiotherapy clinic, uh, private clinic maybe in NHS, not sure about it. So you can get the ultrasound therapy, so which is also doing the anti-inflammatory effect. Well, the hot water bottle can be used for about 15 to 20 minutes. You can use it for 2 to 3 times a day, but you have to be very careful if you have diabetes because you won't have a good sensation. So you should not end up having any, um, you know, damage to the skin. In terms of exercises, I always prefer to start with isometric exercises for the shoulders. Really, isometric exercises are interesting exercises that helps improving the shoulder joint strength. It's a kind of preparatory thing. So you won't make any change to the length of the muscle, but you will build up the strength, which is really an important thing to look into it. So if you look into this picture, the lady is holding her shoulder in 90 degrees and she is trying to push the wall, but she is not actually pushing. So she is creating a tension in her muscle, which isometrically works on her shoulder joint. So again, she is holding on to the holding on the wall, just raising the shoulder about 20 to 30 degrees and pushing against the wall. So the point is you can do in the multiple angles, for example, 10 degrees, 20, 30, 40. Sometimes if you have any stiffness in your shoulder, you can't appreciate the range of motion. So you will be having a limited range of motion. So it's always a good idea to do that. So if you don't prefer to do that, so simply you can hold on to this prayer position and you can press against the arm. So that would help isometrically contracting the muscles. Well, shoulder mobility exercises will always help improving the range of motion and it helps maintaining the range of motion. For instance, if you look into into the video, the lady is just taking her arm sideways. It's always a good idea. So you you would be seeing some patients they can't do as such. So what we do in this case, we will ask them to stand against the wall and just do like wall ladder. So you just use your fingers, you can just do walk on the wall. So that would help improving the shoulder range of motion. So again, in this video, she is moving the arm facing forward. So the shoulder is a joint that would be able to move forwards, backwards, and it can able to rotate in and out. So we have to focus on all the range. If you look into this video, the lady is doing sitting rowing. If you look at her shoulder joint closely, so she is moving her shoulder forwards and backwards. So when she is doing that movement, you would be able to see there is a minimal movement taking place in your acromioclavicular joint, the glenohumeral joint, and the shoulder blades. The scapula will be moving in and out. So if you want to do a shoulder full range of motion, you should have a proper mobility in your scapula bone. So we have to look into the mobility of scapula to have a full range of motion. So this is another way of doing the shoulder range of motion exercises. So if you can't do the range of motion in a long lever, then you can bend your arm and you can do in a reduced leverage. So that would help moving your arm. So here the lady is leaning onto the cupboard. So that is a kind of stabilizing her arm against the cupboard, and she is just moving forward and backward. So you have uh, different ways of doing the exercises, but your physio need to decide like which one would be appropriate for you and suitable for you to do. Always the shoulder rotation is really very important one to do, because as I told you earlier, like abduction, adduction, flexion, extension, and rotation. So this movement we call it as a circumdactory movement. So it's a shoulder rotatory movement. So when you do that, you will have the full range of motion. So you can feel that the bones in your chest and your shoulder blade, everything moves. We have looked into the different types of exercises, the isometric exercises, which we have to start first, and then the range of motion exercises to improve the range of motion. And then we need to look into the strengthening exercises that would help improving the stability and the strength. So if you look into the lady, she is using a resistance band for doing this exercise. So she is having it around her forearm, and she is trying to push against, you know, push against the resistance. So she is actually working on the external rotators. The rotator cuff muscle would be strengthened, and it is working on the scapula bone. It improves the stability of the shoulder. If you look into the next exercise, the gentleman is holding the resistance band with his feet, and he's pulling it up. So he is doing this exercise against the gravity along with the resistance that helps improving the um, front portion of the muscles on his shoulder. So here he is doing this exercise with a long lever, like a long arc movement. So if you find it very difficult, then you can bend your elbow and you can do the exercise in a short arc. And we do have different types of resistance with the TheraBand. So you can select according to the muscle strength that you have. The physio would be able to help you with that. So we call this as diagonal pattern of movement, which is really very important because shoulder joint would be able to do the diagonal pattern of movement. And the weights. So isokinetic exercises. Here you can see like the rotator cuff muscle is strengthened in two different ways. The gentleman is just doing freely, but the lady, if you look into her, she is just supporting her arm and then letting that to go. It's a kind of eccentric contraction. Eccentric contraction is a kind of lengthening contraction, which is really a very good exercise to strengthen muscles. So last but not the least, neck exercises are really very important. So as I told you earlier, the neck also plays the major role in the shoulder joint. So the lady is trying to do the isometric exercises just by maintaining the position and pressing against the arm and holding it for about 10 to 15 seconds. So she is doing the forward, backward, and sideways. So this is to stretch the muscles, the stretch the tight muscles. So just try to bend forward and hold it for about 10 to 15 seconds. So do this for about 3 to 5 times. So rotating the neck to the side and holding it for about 15 seconds on either side. It is always a good idea to start the exercises with isometric exercises. So if it is isometric exercises, you can hold it for about 15 to 30 seconds, usually 2 to 3 sets. But the same thing can be applicable for elderly persons. So always it's a good idea to start with lower count, maybe 5, then gradually progress to 10, then 15 and 20 and so on. So the mobility exercises is something that, as I showed in the video, like you're doing like a free range of motion exercises without having any resistance. So it's a good idea to do those exercises if you wanted to improve the range of motion. So you can do about 12 to 15 counts for about 2 to 3 sets. So strengthening exercises, always you can do strengthen your muscles using the resistance band or dumbbells and so on. So hydrotherapy is also used for strengthening the muscles, but if the muscle power is lesser than grade 3, so always physio will grade the muscle power when they do the functional assessment. So if the person can't able to do the movement against gravity, then we take that as below grade 3. So in that case, hydrotherapy would be very efficient and effective. So always it's a good idea to do the exercise for 2 days, and then the third day the rest, and another 3 days, and the following day the rest. Why rest is important? Because the exercise would cause micro trauma to the muscle tissues. So it is always a good idea to give a rest day that would help healing the muscle, and obviously the muscle mass will improve if you do with giving proper rest to the muscles. Discuss with your physiotherapist before doing any exercises, and because every individual is different, and two patients having the same condition may not be the same. That's all about it for today. Thank you everyone for listening to this presentation. Thank you. I'm always happy to answer the questions if you have any. Saira.
Mahalingam. We'll start with a question on exercise. Question for Kavi. You mentioned exercises for shoulder pain, but there's another question. What exercises are recommended to do regularly to keep the movement active? Also, any vitamins you could recommend to take regularly to keep calcium and other minerals needed?
Yeah, I think this answer we are going to divide. We are going to share this. The medication part, Dr. Arul would be appropriate person to answer. In terms of exercises, as I was mentioning on the during the presentation, so the good range of motion exercises is really an important thing. So always try to use the full range of motion. So if you look into our lifestyle, nowadays everything become kind of easy thing to do. Like we are not reaching to the full range to do the task. So I would advise always to use the full range to maintain a good muscle strength and the mobility.
Thank you.
Yeah. And I think I'll pass on to Dr. Arul for answering about the nutrients. Yeah.
I mean, the main vitamins that we recommend is calcium and vitamin D. It's not needed. Calcium is not needed for all patients really, but I think it'd be good because most of us here are vitamin D deficient, which vitamin D is very, very important for muscle strength. And also it relieves fatigue and, sort of relieves pain as well to some extent. So checking your vitamin D and then taking regular vitamin D is probably what is needed. And of course, having a healthy diet generally is all that is needed for muscle strength. Nothing in particular, because there are lots of medication that you can get to strengthen your muscles from over the counter. Some of them can affect your liver, so be cautious as to what you're taking. Creatine and those sort of drugs, they don't agree with all people, but you have to be absolutely certain and mention it to your doctor that you're taking this for muscle building. So your blood test will need to be done if you're taking any of those. But generally, I would just recommend vitamin D, but anyone 50 or over, especially women, calcium is also important.
Thank you. Thank you. So that means also lifestyle measures like walking, sunlight. Yeah, thank you. And it's a question, there are a couple of questions on frozen shoulder. Is there a connection between frozen shoulder and diabetes?
Yes, there are lots of conditions can cause frozen shoulder. And there is a definite connection between diabetes and frozen shoulder as well. This is because the sugar particles get attached to a protein called the collagen, where in the this is in the tendon or even in the covering of the joint, which is the capsule. And then there are two, it can cause frozen shoulder in two ways. By the sugar particles can irritate the tendons and can cause inflammation. And with tendon inflammation, secondarily, you can get frozen shoulder. Or it can cause, it can become sticky, and then the capsule can hold the shoulder very tight. And that way also it can cause frozen shoulder. So there is an increased chance of getting any tendon inflammation with diabetes.
Thank you. Dr. Arul, you mentioned causes for frozen shoulder in your presentation, but would you mind just briefly going through that again? What causes a frozen shoulder?
Yes, I mean, there is the main reason why frozen shoulder happens is when you don't move the shoulder due to any reason, like either due to pain, whether you have tendon inflammation, and then you're not moving it because you're protecting the shoulder, and that can cause frozen shoulder secondarily. And then any other conditions like stroke and even heart attack, when your shoulder is not moved, then again you can get frozen shoulder. The main reason is because you're not moving the shoulder due to any reason at all. But there are conditions which can cause an immune response as well, like polymyalgia, and there are other conditions. Even after any insult to the body, any surgery and things, you can get an immune reaction as well, when it is a protective mechanism of the body, where it protects the joints, and that is again a reason for frozen shoulder. But as long as you keep the shoulder moving to some extent despite pain, then I think the chances of complete frozen shoulder is less.
Thank you, Dr. Arul. So what is the best? So basically, healthy lifestyle, regular gentle exercises, and keeping your joints mobile is very good. What is the best treatment for frozen shoulder? Would you say injection or physiotherapy?
I mean, frozen shoulder, interestingly, given a few months, can start to ease off on their own as well, but not in everyone. But first thing I would go for is physiotherapy. Just we need to mobilize that shoulder. We need to strengthen it. We need to mobilize it first, actually. That is what is needed. Only when it comes to severe pain and things are not improving as well after a few months, then I would probably suggest a steroid injection
Okay.
within the shoulder joint, within the capsule, really.
Right. So the patients get the physiotherapy and then you give them exercises to do at home. Is that right, Kavi?
Yeah. So in terms of frozen shoulder, so as I told earlier, we will be looking into the range of motion, and we would be focusing mainly to improve the range of motion in abduction and external rotation. So there would be the contracture. So we need to glide and slide the joint. So that would improve the joint play. Then we would be stretching the muscles and then strengthening it. That would help improving the range of motion as well as reduce the pain, sister.
Thank you. Is there a place for acupuncture for frozen shoulder, and can people have it done on the NHS?
In some trusts, it is available still, and most trusts, they've taken it off. It does give pain relief. Definitely, it gives pain relief in most people. Whether it is a long-term relief, I think I'll ask Brother Kavi what his feelings are about it. But I think when the idea is when there is pain relief, you can start moving the shoulder. You can start strengthening the shoulder. So even that little bit of pain, it's the same way why one takes painkillers or anti-inflammatories, so that you can start moving the shoulder and then prevent frozen shoulder happening, really, sort of. And that's the idea of acupuncture as well. It will relieve pain, even if it is short term. If it helps you to move the shoulder, it definitely is a good idea to go for it.
Yeah. It's always a myth, right, doctor? Like if anyone is having pain, they will tend to protect and not move. So we can stimulate moving it. We can start with passive mobilization that would encourage the blood flow. And then we can start with the isometric exercises that prepare the muscles to get strengthened. And then slowly we can, actively mobilize it for full range. And then we can go for further strengthening.
Yeah.
So acupuncture, as Dr. Arul told, that it would definitely work with the pain relief. As a kind of a combination, it would work very well. But we have other mode of treatment as well to relieve the pain.
Thank you. That's very helpful. Thank you. Someone is asking, I do exercises daily, but pain is there. X-ray has shown no damage done. What could be the cause?
Okay, X-ray will show the bones mainly, and X-ray is not that helpful in as far as shoulder is concerned. Sometimes it can even show a little bit of fluid. We can even see that on X-ray, and definitely wear and tear of the joint you can see. But sometimes if there is a complete rupture of the tendon, the shoulder, the arm bone moves up, and you can see that as well. But as the shoulder pain mostly is due to soft tissues around the shoulder, like the tendons, bursae, ligaments. So this, or the capsule, this is not, X-ray is not going to be that useful to find out. It's usually normal. So it's better to go for an ultrasound if you're getting persistent pain. GPs can request it without any problem. It is a very simple test, but gives a lot of information as to what the tendon is doing, whether there is inflammation, whether there is partial tear or complete tear, or even if there is a bursa that is inflamed, it can show all that out. And finally, it can also show the impingement, whether the tendon's being pinched. So the pain could be due to any of these, where the X-ray will be normal. So if an ultrasound is done, then I think you might find out, even if it's a mild inflammation, it will show.
Thank you. Thank you for that. So to summarize, what you say is, X-rays will show the bone and ultrasound scan will show tendons and ligaments and rotator cuff. And then MRI shows both.
MRI is more intricate. It will show. Yeah, it will show. That's again, MRI can show both. A CT shows the bones better than MRI, but I think they both, it can show. It's more intricate, more expensive and more tedious. Lots of patients are not happy to go in that tunnel. They are
Yeah.
claustrophobic, and it's a 40 minutes ride in the tunnel, and it's a longer procedure for something that we could get an answer with an ultrasound. But in some patients, we do go for an MRI if we are really not getting the answer that we need. But ultrasound usually picks up most of the conditions that cause shoulder pain.
Thank you. Thank you for that.
MRI is more intense, and it does definitely pick up a lot more. But whether we need that much more is the question. Yeah.
The radiation.
It's an unnecessary exposure. Yeah.
To radiation. Yeah.
Okay. MRI, there is no radiation center because it is a magnetic field. Yeah. It's not radiation, but it's a tedious procedure going in the tunnel, and like lots of people are claustrophobic.
Yeah.
And so that sort of thing. Yeah.
Thank you. What is the cause of bursitis, and does a TENS machine help?
Okay, TENS machine is very much like acupuncture. I'll let Brother Kavi answer that. And bursitis, there are several reasons for bursitis. Commonly, inflammation. If the tendon around is inflamed, then the bursa secondarily gets inflamed. But also conditions like gout and pseudogout, which is a different crystal to gout crystals, they can all accumulate within the bursa and cause inflammation as well. So it is mainly a strain of the shoulder that causes the bursitis. And I'll let Brother Kavi answer.
Yeah, so in case of bursitis, our treatment choice would be more of ultrasound therapy. In simple, like the cold pack would be very efficient with some isometric and gentle exercises. Rest is really very, very important in terms of, bursitis. So the bursitis could be due to repetitive stress injury. So first choice of treatment is ice with rest. And the TENS would work mostly on the muscle spasm and the pain in the local area. So for a bursitis, I would not recommend TENS application.
Right. Okay. All right. Thank you. Thank you for that. Need specific exercise for chronic rotator cuff tendinitis. It is very painful and had it after COVID vaccination. Any comment on that?
So, yeah, we need to look into the age of the person, and we need to look into the the mobility. So how much range is available and what is the strength. So particularly in elderly with osteoporosis, it is really a good idea to start with isometric exercises. So just hold on your arm by yourself with the hand and just try to pretend that you're pushing. So just press and hold it for 15 seconds, as I told during the presentation, and then relax. The isometric exercises would be really very helpful on a long run. So we need to, promote the mobility. So that would be helpful, sister.
Thank you. Thank you, Kavi.
Yeah.
What sort of painkillers you would recommend for shoulder pain?
If one could take anti-inflammatories, that's probably better. But anti-inflammatories shouldn't be taken in the long term. But you can start off with simple painkillers. But I think as there is going to be inflammation in most cases, ibuprofen type tablets along with the stomach protection, that is what you really need, because it can, in the long term, there are lots of side effects, unwanted side effects with anti-inflammatories. But short term, it will definitely help. Again, as I mentioned before, with the painkillers, you will get pain relief, and then you can start moving the shoulder. That is the main reason that I would recommend anti-inflammatories.
Thank you. When would you consider shoulder injections? Is it effective?
Okay. If a person has tried everything and it's been going on for quite some time, if definitely not less than 3 months. We wouldn't give a shoulder injection within 3 months. But if the pain is severe, they are getting a lot of night pains, then we do, in rheumatology, we do give shoulder injections. And sometimes in frozen shoulder, that I tend to give shoulder injection as well within the joint to release the stickiness of the capsule. So that is the main reasons when we give. And the third thing is, if it is going to be due to gout or any other inflammatory conditions like rheumatoid arthritis, then we give a shoulder injection, because it definitely helps. The steroid helps the inflammatory conditions as such. And the fourth reason I would give is when there is fluid in the shoulder, you need to aspirate or take the fluid out. And if you think it's not infected or it looks a clear fluid, then you can inject it at the same time when you're taking the fluid out. That prevents it from forming fluid again very quickly. These are the main reasons why I would give shoulder injection.
Okay.
Here, I would like to add a point, sister. So as Dr. Arul told that, I would say that in my personal experience, I have looked into a few patients with a shoulder problem. So they have came to us, in a very later stage. There was complete wasting of the muscle, so it won't work with the exercises, obviously. So we need to, as doctor told, we need to try immediately after 3 months. So after that, we need to start moving it and to strengthen it. So just not leave it like that. So it would cause muscle wasting, and it would play, it would reduce the range of motion. Then the shoulder can't be used at all.
Right. Okay.
Yeah.
Okay. So if somebody benefits from that, how often would you consider giving them steroid injections?
Right. Okay. Usually one injection. Usually one. And in some cases, I think if it's not completely gone or partially responded, then I would probably go ahead and give another injection between 6 and 12 weeks. And I wouldn't give more than 3 injections for any shoulder, only because if it's not going to respond in 2 or 3 injections, it's not going to respond again. And it can cause further damage, like it can cause osteoporosis locally, and it can thin the tendon even. And sometimes it is not without risks. I mean, it can cause tendon rupture and infection and all that sort of thing. So I wouldn't give more than 3. But if I'm giving sort of 6 to 12 weeks, maybe maximum 3 injections, if they are responding to some extent. If there is no response, I would just go ahead and get scans and find out what's going on.
Thank you. Thank you very much. Last question. Any advice to prevent shoulder dislocation or subluxation? Is surgery needed in all cases? Last question. Thank you.
So in terms of prevention, I would advise the exercises. We have proprioception-based exercises. The proprioceptors are the receptors that is located in the joints as well as the muscle that sends the signal to the brain about the position of the joint. So if you look into some people, they will be having hypermobility or lack of stability in the shoulder joints. So I'm kind of crazy in using the isometric exercises. It does amazing effect on the stability. So we do have PNF exercises, like the specific exercise which stimulates the proprioceptors and help maintaining the position of the shoulder. So that is really a good one to maintain the stability of the shoulder system.
Request to get a couple of questions from the just coming now. Is that okay? So they're asking, please give specific exercise for chronic rotator cuff tendinitis.
Okay, so for rotator cuff tendinitis, obviously we need to, in the acute stage, if you do the exercises, it would aggravate the pain. So we need to work with the medication, and then we need to apply the cold pack. And once the inflammation is reduced, then we need to start mobilizing the arm within the pain-free range of motion. So after that, we can strengthen, for example, in case of rotator cuff, we need to focus on the abduction and external rotation strengthening using the resistance band. So that would help relieving and strengthening the rotator cuff muscles.
Okay, thank you. Two more questions. I have a pain in my middle deltoid whilst lifting weights at the gym. It's been going on for 6 weeks. Is there anything that I can do?
So I think we should give rest, because there could be an repetitive stress injury. There could be micro trauma happening to the muscle. And we need to look into the muscle power and the posture. So particularly people who are working in the gym. So sometimes if their posture is kind of rounded shoulder, and if they try to lift more weight, so there is an imbalance happening in the shoulder that would cause pain in the deltoid. So we need to look into the posture, and we need to sort out what is causing the problem. And if there is any pain, then we need to give rest for a while and see whether it is settling down or not.
Thank you. Last question. Most of the IT people spend a lot of time on desk-based jobs.
Yeah.
What kind of exercises do you recommend to keep shoulders healthy even at old age?
Yeah, that's really very interesting stuff. So we need to follow the ergonomics. So we need to make sure the sitting position, it is always recommended to have a good workstation, which is really very important to keep our posture perfect. And in terms of shoulder, it is really a good thing to do the neck isometrics and the shoulder mobility. For instance, like they can hold on to the neck sidewards and push against the arm, hold it for 10 seconds. So you can do it on either side, front and the back. And then the shoulder mobility. So shoulder mobility is always better to reduce the leverage, and just when you lift the arm, so try to make sure that your elbows are coming together, and try to take up higher and then take it backwards. So a complete rotation. So if you try doing this before and after work and during the time of work, you try to avoid sitting completely on the desk. Keep moving. For instance, try to keep the printer a bit away. So make sure that you're getting up from the station. So that would be a good idea. So I would advise the isometric exercises and the rotation exercises, and we need to make sure about our posture. So posture is really an important thing. So when you're sitting in a wrong posture, obviously the gravity will take the advantage, pulling forward. So when it is pulling forward, the muscles which is behind the back would be fighting against the gravity, and it goes for kind of stretched position, which goes for weakness, and the muscle at the front would go for tightness. So we need to correct the muscular imbalance by having a proper posture, and we need to maintain the stability by doing isometric exercises, and keep up the full range of motion by doing the mobility exercises. If we couldn't do exercise daily, at least try to make sure that you're doing 3 to 4 days in a week would be absolutely fine.
Thank you. That's very helpful. Thank you very much. Thank you, Sairam. I would like to thank, can you hear me? I would like to thank Dr. Arul and Mr. Kaviarasu Mahalingam for the excellent presentations and for answering all our questions. A big thank you to Brother Seshan for the IT support, and Brother Anbu for the introduction, Dr. Upadhyaya for guiding and supporting us, and Sister Gayatri for coordinating these webinars and all the background work she does tirelessly. We thank all of you for joining this session, and we really hope that you found it informative and practical. We look forward to welcoming you again at our next webinar in a month's time. Sai Ram. Thank you.